China U.S. Women's Foundation's Health Series, Two Things That Women Need to Know. We discuss different illnesses that are common to women so that you can get the help that you need in order to feel well. We are fortunate to have Dr. Melinda Wolf, an expert on women's health, here with us to discuss, today we're going to discuss chronic pelvic pain. Hi, Dr. Wolf.
Hi, Leslie.
Thank you for being with us.
It's such a pleasure. Thank you.
Could you tell us, first of all, what is chronic pelvic pain?
Chronic pelvic pain is a condition that affects millions of women around the world, and it often is a challenge to discover what is the underlying cause. It is pain that can come and go. It doesn't have to be constant and lasts for at least 6 months, but it's lower abdominal pain that often mimics the irritable bowel, and it affects the bladder and really affects all of the woman's sense of well-being.
Is it connected to a woman's period?
It's actually separate from the cyclical pain that comes from the ovulation and the PMS changes, the premenstrual syndrome changes that women have. But often there are conditions related to the lining of the uterus and the uterine tissue that can be a cause of pain.
So what should a woman do if she's feeling pain in the pelvic area and it's not going away?
First of all, it is important that a woman actually be her own advocate, to look online, since everything is available online, to look online at the different conditions. One might have a condition called endometriosis, which is abnormal uterine tissue in the pelvis. It can be related to irritable bowel, to a spasm of the bladder. It can even be related to ovarian cysts and uterine fibroids. So for a woman to educate herself and to write her symptoms down, and then to certainly go to see her doctor.
So I understand you keep track of your symptoms and try and monitor what it is your body is telling you. So you go to the doctor, and what do you share with your doctor in order to try and get him or her to understand what it is you're feeling?
Once you've shared with your doctor the symptoms, he or she will ask additional questions, but often the questions that are asked may not lead to the diagnosis. So blood work is checked, and an ultrasound of the pelvis, sometimes a CT scan of the pelvis. But as I said before, the diagnoses can be challenging.
Well, thank you, Dr. Wolf. In summary, it sounds like a woman, first of all, needs to listen to her body and even write down the symptoms. Then a woman has to advocate for herself when she goes to a doctor in order to ensure that the doctor understands what she's saying and is working with her to help her feel better. Every woman has the right to feel healthy. For more information about chronic pelvic pain and other common women's illnesses, you can go to the China U.S. Women's Foundation's website, cuswf.org, where we list various illnesses with links to more information. Thank you.